of our country. And so, the public health measures that we speak about were really, for a long time, adhered to before some, people got tired later in the year. And we carried out an effective public health response. The things that might be new to some people, the details of contact tracing, identifying cases, isolating them. We've unfortunately had the opportunity to do this severally for many outbreaks that we faced in the past. So it wasn't like new to us, and we mobilized our resources fairly effectively to deliver on this. And thankfully, we have the numbers that we have. But just recently, we carried out a seroprevalence survey in 4 states in Nigeria. And in Lagos State, for instance, we found a seroprevalence of 23%, of course, with confidence intervals around that, meaning that there must have been a lot more infection that we had found through our surveillance system, meaning that there are a lot more mild cases of infection. And this might be as a result of the very young population in Nigeria. And so there are many things that drive the response that we are still learning. But the key thing is, unlike previously, we are part of the science. We're part of the discovery. We're learning as we're doing, we're iterating and using what we learn to shape the response in real time. And that really is one of the most important parts of this response. And working together with WHO and with all our partners, we've been active participants in our own destiny and not reliant on just support from the outside, because the borders were closed anyway, and we couldn't get as much support globally as we would normally have. On the second questions, on the number of people we intend to vaccinate, like every country in the world, we want to vaccinate as many people as possible. That's a legitimate desire by any country, and that's the same here. But we also recognize the need for equity in distribution of access. And that's why we have aligned very strongly with the African Union and Africa CDC's approach, because even within the continent, there are also differences in countries' abilities to support their citizens. But Nigeria has been very firm in saying that we will not look for bilateral deals. We will work in a multilateral way with WHO, with COVAX, with the African Union, to make sure that as we get vaccines into Nigeria, the same happens in Benin, in Togo, in Ghana, in Cote d'Ivoire, in Senegal, in Ethiopia, across the continent. So we're working very hard to get as many vaccines as we can get into Nigeria, at the same time working with our brothers and sisters across the continent to enable them get as well. So we're looking forward to our first deliveries. We've looked at the deliveries in Ghana and Cote d'Ivoire with a bit of excitement, but also a lot of desire. We want to see the same happen in Nigeria over the next few days. It's the biggest country on the continent, and I think getting the outbreak under control in Nigeria will serve the continent well, it will serve the world well, and we look forward to receiving those vaccines soon in our city, in our country's airports. Over.
Thank you, Dr. Chikwe. I would like now to invite Jamie Keaton, Associated Press in Geneva, to ask the next question. Jamie, you have the floor.
Thank you, Fidela. Thank you so much. Nice to see you all. As you may know, Pope Francis is scheduled to make a 4-day visit to Iraq starting a week from today. There are expected to be masses outdoors and inside, both indoors and outdoors, and trips to various parts of the country are expected to draw large crowds. The Vatican delegation and accredited media are all vaccinated, but the Iraqis most at risk are not. And Iraq recently went into a modified lockdown with schools and mosques closed and a nighttime curfew due to a surge in cases, many of those linked to the variant that emerged in the UK. So my question, can you remind us of WHO's advice about mass gatherings, especially in countries facing severe outbreaks, and the epidemiological wisdom of such a high-profile visit that is likely to draw big crowds? And what would you advise the Vatican about ways to ensure that it will not inadvertently provoke a super spreader event? Thank you so much.
Jamie, you were talking about Iraq, huh?
Correct.
Yes.
So thanks for the question. So WHO has issued guidance on mass gatherings, whether these are gatherings that are planned or gatherings that are spontaneous, taking a risk-based approach. It depends on a lot of different factors that are happening within the country in terms of the epidemiologic situation, the handling of the event itself in terms of if it's indoors, if it's outdoors, the nature in which, how many people will be there, if there can be physical distancing, the use of masks, etc. So if there's a plan that's in place, what the event holders will do in the case of someone who is sick, someone who is symptomatic, someone who is a case, how they can carry out all the necessary public health actions. We have issued this advice many, many months ago, in which all countries are using to take a risk-based approach on those decisions on if an event can happen, and if so, how it can happen safely, and if not, if that event can be postponed. This is the same for mass gathering events that are large, and it's the same advice we would give for gatherings that are happening at people's homes, if they're having birthday parties, for example. It's all about managing that risk. So there is no one short answer of if an event can be held or not. It's about looking at the epidemiologic situation in the country and then making sure that if that event is to take place, that it can take place as safely as possible.
Thank you. I would like now to invite Sara Teofilo from Correio, Brazil, to ask the next question. Sara, you have the floor.
Hi, thank you for taking my question. Brazil is having its worst moment during the pandemic with a high number of deaths and a lack of ICU beds in several states. The occupancy rate of ICU beds is above 90% in many of them. I wonder if we can blame the new variants for the collapsing health system and if increasing the number of ICU beds is enough to solve the problem. Thank you.
So I didn't quite hear all of your question, but I think we spoke on this last week, both Maria Angela and myself. There was that not all countries were in a downward trend, and there was a persistent trajectory of cases in Brazil, and certainly we haven't seen a prolonged downward trajectory. Maria Angela explained at that time that there were different trends happening in different parts of Brazil. It's a very, very large country and a complex situation. But there's no question that Brazil is not the only country facing this situation. There are many countries in which the downward trend is not happening. There are many countries, thankfully, where that is happening. And there are many countries in which that downward trend is not being achieved. The contribution of variance to that situation is not fully understood in this particular case. What we do know in countries that are applying persistent and consistent measures in terms of public health and social measures and individual behaviour, that is affecting the trajectory of all variants. And even though some variants have shown a propensity for higher levels of transmission, what is clear is that the control measures that have been designed are effective in driving that down. We've seen in the past that just ramping up health systems capacity is not enough. Your health system will be overrun if the force of infection, if the trajectory of cases is rising, and your health system cannot cope today. It will certainly not cope tomorrow if that pressure continues in the system. So yes, it is always good to shore up health capacity. It's always good to be able to open more beds and to move health workers from areas under less pressure to support staff in other areas. All of that is good, but that in itself is not enough. You have to get to grips with the transmission as it's occurring at the community level. And many parts of Brazil have suffered intense community transmission over a very prolonged period of time. It's been very tough for Brazilians and for Brazil in general. And it is very difficult in a populous country where people are very often living in multi-generational, multi-family homes, many living in peri-urban areas where poverty and lack of access is a major issue. So it is easy to sit here and talk about what should be done. It's very difficult in reality to achieve that in some of the settings that the Brazilian authorities face and the communities themselves face. But there is no other way. The only way out of this is to do that work. You heard Chikwe, and congratulations, Chikwe, you have a tremendous admiration. Nigeria is a very similar setup, a large country with large urban centres, and they really had to come to grips with some very, very difficult decisions and to remain cohesive and persistent in the application of those measures, while taking into account and recognising the economic and social toll of that, and finding the balance between those measures to keep the rates of transmission at a low enough level to prevent the health system becoming overwhelmed. So many countries have faced that reality. Unfortunately, and it is a tragedy for Brazil, that Brazil is now facing that again, and it is tough. This is the fourth time round for Brazil, I think, Mariangela, at least. And the situation in Brazil has improved in some areas while disimproved in others. So I don't think there's been a point in the last year where some part of Brazil has not been deeply affected by this pandemic. So it is very tough, and we should take a moment to show solidarity with the people of Brazil and to provide the necessary aid and support needed for them to be able to come to grips with this disease. But again, Brazil is a very able country and has many fantastic public health and scientific institutions, and I think Brazil knows what to do, and many states are trying to apply the best measures, but it's not straightforward, it's not easy. But I think it's a lesson now for all of us that this is not over. It's not over for anybody, and any relaxation of our resolve is dangerous, and we need to, as I say, be very aware this virus still has a lot of energy, and if the measures we apply are not persistent, comprehensive, and aimed at continuing to suppress transmission while introducing vaccines, we will pay a price, and unfortunately our communities will pay a price as well.
Yeah, very briefly, I just want to take an opportunity to mention the variants, because the question also said, is it due to the variants? Now, you've heard us say that there are variants of concern that have been identified from some countries. WHO actually issued some definitions yesterday on our website in our weekly epidemiologic update, which outlines proposed working definitions. I say working definitions because these may change over time as we learn more about them. But these are working definitions of variants of interest as well as variants of concern. And this is meant to help guide countries in looking at the viruses that they are detecting in their countries and looking at the full genome sequences that are being conducted by countries, and to see if there are any changes in these viruses. And using these definitions, what actions they need to take to report to us, what studies need to be done in country. We've set the threshold for determining a variant of interest very low so that we can capture that they're sensitive enough to capture potential important variants, but we've also set the threshold for the determination of a variant of concern very high, so that we could focus the attention and resources on variants with the highest public health potential. This is important. So this is on our website, and we'll provide the link in the chat below so that you can see this. We expect that there may be some modification of these definitions over time, but this is meant to be a helpful guide to determine which of these mutations, which of these variants are interesting in the sense that they may have some public health importance, some public health impact potentially on some of the countermeasures as we go forward. And this is a system that needs to be in place as we go forward as this pandemic evolves. Some of the virus variants that have been detected, the virus variants that WHO is tracking, have shown some increased transmissibility. And if you have increased transmissibility, it means you have more cases. If you have more cases, this means you can have more hospitalizations, which can put some burden on the healthcare system. And in some countries, the healthcare system is overburdened to begin with. And this could lead to an increase in severity and death. And so we want to make sure that the measures that are in place are preventing as many infections as we can. So far, based on all of the variants that we have seen that are being tracked, the public health and social measures, the infection prevention and control measures in health facilities and outside of health facilities work against these virus variants that are circulating. We are seeing this in country after country as incidence declines. We are seeing this directly from studies that are being conducted in countries that have these virus variants that are predominantly circulating, and this is good news. But we need to continually monitor this. So we have a system, a global system in place to not only identify which of these mutations are important, but what they mean in terms of transmission, in terms of severity, and in terms of any potential impact on available and future diagnostics, therapeutics, and vaccines. We are working with partners all over the world, in country, as well as public-private partnerships with all of the different manufacturers to make sure that we can monitor these almost in real time. That is difficult because it takes time to do some of these studies, but we are very grateful for all of the collaborations around the world and the institutions that are helping us track and monitor these. So do look on our website related to these definitions, and we will be providing weekly updates in our SITREPs that we release every week on our WHO website, summarizing what is being tracked globally.
Thank you. I would like now to invite Jeremy Lange from Radio France Internationale, RFI, to ask the next question. Jeremy, you have the floor.
Thank you, Fadila. I'd like to go back to what you said at the beginning and what you're tirelessly saying on every press conference, the fact that you're asking countries not to go directly to the manufacturers to get more supplies and bypass COVAX. So my question is maybe blunt, but is anyone listening? Do you feel that any country is actually listening? Because we hear every week, last week again, the EU is getting more doses from Moderna. So do you actually have one example of one country that's saying, okay, we get it, we're not going to do it anymore? And do you have any, are you confident about the next week proposal at the WTO about the intellectual property waiver that could be a major success for the COVAX? Thanks.
Dr. Aylward, you have the floor.
Thank you very much. I think I counted 4 questions. But the key one is, are countries listening about the importance of making sure that we do not interrupt the supply inadvertently to other countries? And absolutely, countries are listening. It was a bit of a free-for-all, quite frankly, a few weeks ago and months ago, as countries were pursuing deals that could have, let's say, compromised the supply through COVAX. There is still conversations ongoing, yes, very, very much so, but countries are definitely listening, which was your first question. Countries are definitely listening. Now, some countries are still pursuing deals that will compromise the COVAX supply, without a doubt. While, let's say, all countries are listening, not all are acting on what we are asking for, and that is that they respect the supplies to COVAX. Some of the major suppliers to COVAX, like the Serum Institute of India in particular, as the Director General said, is being approached by multiple countries that had not originally intended supply from that site. And as that site was originally thinking to supply COVAX and to supply India, any other demands on it do put a strain on, potentially on the supply, to be very frank. But your first question was the most important one: are they listening? And I think following the Director General's highlighting of this issue and others, yes, they are, and I think that's great. But once again, we have to recognize every country is just under tremendous strain and demand. It's tough. Politicians, as Mike has said, and the Director General repeatedly, are under incredible expectation of their population to deliver vaccines as rapidly as possible. And what we have to remember is that's not politicians in just some countries, it's everywhere. And what we need to ensure is that the health workers and then the older people in populations, and then of course those with other risk factors, receive vaccine as rapidly as possible. So people are listening. Some are acting on that. We hope more will. And just over the last few days, we've been able to lock in through the COVAX facility and the great work being done by Gavi, UNICEF, and others. Through all that partnership, been able to lock in the volumes that we're going to need over the coming weeks. But there's never enough supply, quite frankly. We need more countries acting in support of COVAX as we go forward. The last point you raised about what will happen at the WTO next week, I don't think anybody is confident about what the outcome will be, so I think next week we'll all hear. Again, what we're encouraging all countries and companies at this point is to be doing everything possible to expand their production. And that's going to require a range of solutions like the Director General highlighted. The most successful way and rapid way we believe to expand production is through technology transfer, sharing the know-how, through voluntary licensing as needed with other manufacturers that can fill and finish product, that can produce product, and that is usually the most successful way to do it. It's when that fails and we're in an emergency like this and we can't expand production that people want to look to other measures.
Dr. Simão, you have the floor.
Sorry, a very quick compliment on the TRIPS waiver. We heard earlier today a question about the Security Council, and WHO very much welcomes that the discussion around the provision and the making equitable access a reality is happening in different bodies at the UN. So we very much welcome the discussion on the TRIPS waiver at the WTO TRIPS Council. And that said, just complementing, because we are, of course, this intellectual property is always a very sensitive topic in anything that's related to access to medicines and to vaccines and other health products. And we are living through a situation where there's an extreme concern by countries and also countries looking for alternatives to increase production capacity. And of course, this includes how to manage the intellectual property rights, and this could be managed through various forms, include to voluntary license, like Dr. Award was mentioned. Just to say that WHO does coordinate the COVID technology access pool, which works with, it's working with 44 countries now, to include not only the sharing of technology, but also the voluntary licensing of the technologies that can help us to address the acute phase of this pandemic. So, of course, we are very interested in the outcomes of this discussion at the TRIPS Council, as we welcome any movement from countries to decrease and to address current barriers to access, and also barriers to access that could be seen at mid and long term. So this is quite an important discussion. Thank you.
Thank you, Dr. Simão. Dr. Ryan?
Just a very short point. I think we need to continue to close the gap between the rhetoric and the reality, and I believe there's a healthy debate going on in many countries, and that's great. But there are some countries where there isn't even a debate. And I'm afraid, like the old adage says, that you can't have your cake and eat it too. I think some countries think that they can.
Thank you. I would like now to invite a journalist from BBC Africa. I hope I pronounce well your name, Charles Mbolu. Charles, you have the floor.
Thank you. That was a good effort. You tried. Thank you. So my question is to Dr. Chikwe. I just wanted to know, you mentioned that the vaccines are expected in a few days. I want to know, because there have been questions about storage of these vaccines and the general handling of the vaccines. So how confident are you that there is enough facility on the ground, or if there is enough facility on the ground to handle the storage, about the storage of these vaccines? And also, what's the plan in terms of the order of vaccinations? We are seeing in local media that politicians may be giving vaccines ahead of all the perhaps health workers. So just help to clarify that. Thank you.
Dr. Chikwe, you have the floor.
Yeah, so thank you very much. The whole country really is looking forward to the vaccines, that's for sure. But having said that, we've had many challenges in Nigeria, but some of those challenges have also brought opportunity. So last year, we finally eliminated wild poliovirus in Nigeria and therefore on the African continent. it meant that over the last few years, I don't know any country that has done more vaccination campaigns than Nigeria. The people involved in doing micro-planning, delivering of the vaccines, planning logistics, they do this in their sleep. We have an agency responsible for this, the National Primary Healthcare Development Agency. They have a well-fueled system delivering to the states, then the states to the facilities, and all of these have been in preparatory mode for the last few weeks, working very hard to cross the T's and dot the I's. So we were very anxious when it looked like we would get the Pfizer vaccines in the beginning because of obvious challenges around storage outside of our major cities. But once it became clear that the first set of vaccines would be the AstraZeneca Oxford vaccine, we became fairly confident that with the infrastructure we have, with the human resources that we have, and with the delivery, Nigeria, we deliver at critical time. So we are confident that we will be able to do this. On your second question on prioritization, everyone, I think will be remiss to get this wrong. Every country, people are looking. We have a very open, vibrant media space. Government has actually been very transparent in the work that we've done. There's not been any, we've been very open in communicating to Nigerians and globally in terms of our challenges and opportunities. So we've been clear, we will prioritize our healthcare workers absolutely first. There will be some others prioritized for various reasons, but I think we must trust the leadership around this. We're making some very hard decisions. I think at the end of the day, the key thing is we all recognize that we can only impact on transmission and on reduce the burden in our hospitals if we target the right people initially at the right pace and at the right distribution. So everything will come into play, not only the priority population groups, but geography as well. We have a very uneven outbreak in Nigeria. Lagos State, for instance, has 40% of all the cases in Nigeria. So it wouldn't be a surprise if they are prioritized to a certain extent. But at the same time, we need to get some vaccines to every state in Nigeria. So it's a big country, complex country, but a lot of detailed planning is going on into ensuring that the vaccines get to the right people as quickly as possible so that we can get the outbreak under control in Nigeria.
Thank you, Dr. Chikwe. Dr. Kazadi Mulombo, if you want to speak, you are welcome anytime.
Regarding the preparation and the prioritization, the health worker has the first priority for this first batch of the vaccines, and then there are actually four stages in this vaccination. So the health worker definitely they are their priority, and then we have people with underlying condition, which is the next priority. Then the elders and the other groups, including those living in IDP camp and the vulnerable population, and those working in difficult to reach area, where we could use, our experience for polio to reach out to reach area and to reach those that are currently living in inaccessible area due to some security concern, as we know. And the WHO, UNICEF, the World Bank, and other UN agencies, we've been working hand in hand with the government. We are part of the planning, we are monitoring, and we are ready to continue to support the country to roll out the vaccine in as equitable as possible way, so that we could achieve the benefit of the vaccine. If we are able to vaccinate enough to get the necessary coverage and achieve herd immunity, that will be great. But for this year in 2021, we are targeting 40% of the population, 20% coming through the COVAX, an additional 20% through the government funding. And the donors are prepared to chip in and help Nigeria get all the support needed, including for operational and logistics. Over.
Thank you so much. I would like now to invite John Zaracostas from France 24 English Service to ask maybe the last question. John, you have the floor. John, can you hear me? You are unmuted, John.
Fadela?
Yes.
Okay, good. My question is to Dr. Ryan and to Maria on the podium. I don't want to sound as a Cassandra on a Friday evening, but is there a black swan situation where we could have a second pandemic threat in parallel with the current pandemic? And my concerns were raised about the Russians notifying to the WHO the new cases of H5N8.
Thank you, John.
Hi, John. Nice to hear your voice. There are possibilities and there are possibilities. WHO, as you know, is an organization that is constantly looking at the potential pandemic threats from a large number of new known pathogens as well as new pathogens. This is why we have a health emergencies program. This is why we work on preparedness and response, why we have people all over the world who are setting up surveillance for known pathogens and viruses and the unknowns. And we work very closely with our partners at FAO and OIE to be tracking different viruses in animals that have the potential to spill over into human populations. What we do is we work in countries to make sure that we have good surveillance in place for rapid detection, for good early rapid response, and making sure that we have systems in place, laboratories in place, public health systems in place to be able to detect and respond and act. You have an excellent example today in Nigeria with our WHO representative, and Nigeria CDC showing that years of preparedness for infectious diseases are put to good use for the latest disease X, which happened to be COVID-19, SARS-CoV-2, the virus that causes COVID-19. So we are always looking at the possibilities that there could be additional threats against our planet, against the human race, and of course there may be. We have a flu division, our global influenza program, that are tracking influenza viruses, seasonal influenza viruses, looking at avian influenza viruses constantly. That work has not stopped. We have teams that are looking at Nipah viruses, that are looking at Ebola viruses, that are looking at Lassa, that are looking at chikungunya and Zika, and I could go on and on. And so that work doesn't stop. And I think it's important to mention, I'm giving a long answer here because you hear us speak a lot about COVID-19, but there's work by WHO and our thousands of staff around the world in our 150 country offices and our 6 regional offices, as well as our partner agencies and ministries of health, ministries of agriculture, ministries of the environment, that are constantly on the lookout. And so, yes, there's always the possibility that there could be additional threats. But what is important is that we have those systems in place and that we use the time right now in this traumatic experience that all of us are in for COVID-19 to make sure that we don't lose sight of what could happen in the future, and we're building back systems that are sustainable for any infectious threat that could come our way. We are tracking this H5N8. There was a disease outbreak news that was released a few days ago looking at some cases, asymptomatic cases in Russia. Our flu team this week is actually discussing vaccine composition for the next influenza season. So all of this work is happening in the background. You don't get to see them up here every day, but they will be releasing their findings from that deliberation this week. So yes, we are constantly tracking these, and you'll hear about this through our disease outbreak news, and we will follow up with any advice that is necessary as quickly as possible.
Just to maybe add this, who is announcing the recommendations for influenza strains to include in the vaccines for the 2021-2022 Northern Hemisphere season. And again, expressing huge gratitude to the hundreds of labs in the network who constantly track the evolution of influenza viruses around the world, including the genetic sequencing and characterization of those viruses, both epidemiologically and clinically, which leads to the instructions to the manufacturers for the best components for vaccines every 6 months. That process is in place, and we're looking to create a very similar and linked system for SARS-CoV-2 as well. So the world is being well watched over in that regard, but again, reflecting on the power of partnership between scientific institutions, the power of our member states and partners, public and private sector, who work together constantly to keep the world safe from influenza. And it's more important than ever. The current pandemic has led to, in effect, the same measures that have stopped SARS-CoV-2 have also effectively suppressed transmission of influenza. That means there's a lot of potential energy left in the influenza virus, especially as normal and natural immunity will wane. So there will be, at some point, a rebound in influenza. So it's exceptionally important that we continue to work on that, and that we reiterate that influenza vaccination remains the best tool for prevention of influenza. And we should plan now, while we're procuring vaccines for COVID-19, it's very, very important, but we also, governments need to continue to plan for their influenza season and remain vigilant for influenza in all its forms. Part of the reason for tracking the avian strains, and again, this again reflects a tremendous amount of work that goes on in tracking these viruses that cross the species barrier, mainly through avian strains. The virus associated with the H5N8 incident in Russia is currently being fully characterized. And part of that process with industry and with the WHO collaborating centers is to constantly produce candidate vaccines. We talk about vaccine production happening for SARS-CoV-2, it's very important. But remember, there are manufacturers out there and our collaborating centers who, as soon as there's a signal of a new virus or a virus with potential to infect humans, they immediately begin to produce potential vaccine lots, so that if we see any shift towards human transmission or towards an epidemic in humans of a new virus, that we have the immediate capacity to begin scaling up vaccine trials and vaccine production. And this is really, really important health security work. And just while I have the floor, to say to Dr. Chikwe that Nigeria's Centre for Disease Control and your personal leadership there, both in public health and in science, reflects something I think that's not recognized globally. I look to Dr. Chikwe in Nigeria, to Dr. Sakoba, the head of the National Agency for Health Security, who's leading the fight against Ebola in Guinea, to Drs. Moyembe and Sabwe and Akahuka in INRB and DR Congo, who co-developed the monoclonal antibodies that are now curing this disease in Guinea. The leadership, Dr. Chikwe, you showed in developing the research roadmap for Lassa fever and all of those other diseases. There is a perception out there that disease X and all of these sophisticated emerging diseases are being responded to, and all of the science is happening in the north. That is not true. The first line of defense is in the areas most at risk, in the areas of high biodiversity, in areas where these diseases can cross the species barrier. And it is to the great comfort of the world to know that there are such wonderful scientists working in the front line who understand how to do this business extremely well. And I think we need to do more of that. We need to build the capacity to understand, detect, to characterize and develop countermeasures as close as possible to the point of disease emergence. And we need to invest in institutions like the Nigeria CDC and in individuals and science and public health leaders in these countries who do an amazing job with very little resources. I also congratulate Austin Demby, who's the new Minister of Health in Sierra Leone, who himself has a massive historical background in the study of emerging diseases. I don't know if there's ever been such a concentration of expertise in any given sub-region of the world of true leaders in the area of science and emerging diseases. And I think it's a wonderful it's a wonderful thing for us to be able to recognize today.
Thank you, Dr. Ryan. We have gone over 1 hour since we started this press conference. Before handing over to Dr. Tedros, I would like to invite our guests, if they have any final comment to make. Over to you, Dr. Chinkwe or Dr. Kazadi Mulambo. You have the floor.
Well, thank you very much. I'll start that my brother Walter will close. Just to say thank you very much. You know, there have been discussions about the role of WHO at various points in this outbreak. And I think for us on the African continent, it's unfathomable for anyone to even think about minimizing the role this organization plays to pull us together, to hold us together, to guide us as we develop our own capacities to look after ourselves, which we've been doing over the past few years. I think the way this outbreak and pandemic has panned out has really brought to life how interdependent we are on each other. When we spoke about this in the field previously, it seemed like a hypothetical scenario, but this outbreak has really shown, whether you're in the north of the world or in the south, west, east, rich, poor, you know, we are all at risk, and it's in our own individual best interest to make sure that all of the world is protected against the threats that we face. So as we get to the point of rolling out immunization, vaccination campaigns in our countries and refocus on the tools that might take us to the end of this outbreak, it's important that we don't lose focus on the broader issues on how we collectively think about how to make our world a safer place for all of us. Walter.
Thank you, Dr.
Thank
Chikwe.
you. Thank you again, DG, and thank you, my brother, Dr. Chikwe. To close this session, I would like to recognize really the type of relations I can see between WHO and the Nigerian CDC and even the government. The relationships are very strong. And WHO is really a trusted partner, particularly when it comes to ensuring that coordination is effective among several players. When I resumed in June last year, that's the main assignment I was given by the authorities to ensure that there is coordination among players. And we believe as WHO, so far, we play that role. We've managed to rally many stakeholders, private sector, the government, the community, around one purpose: to suppress transmission and to save lives. We've learned a lot so far through this pandemic response. And we think there is now an opportunity. It's time to re-engineer health security agenda in the way we implement it, alongside universal health coverage, as the other side of the same coin, like DG Tedros used to say it. Thank you so much for this opportunity to share our experience. Over.
Thank you, Chikwe. Thank you, Walter. Thank you so much indeed. Maybe I would like to say a few things given the UN Security Council's vote earlier today. We can't beat COVID without vaccine equity. Our world will not recover fast enough without vaccine equity. This is clear. So sharing the vaccine which is being produced is actually the best way to bring lives and livelihoods back to normal. So it's in the interest of all countries to cooperate. There are, in terms of vaccine especially, what they call elephant in the room. Some of the things that we need to take, some of the measures we need to take. For instance, the sharing problem can be addressed effectively if production is increased. And to increase production, there are trade barriers or other barriers that has to be addressed. I think a good number of them have been listed before. Could be technology transfer, could be voluntary licensing, and temporary waiver of intellectual property. Especially when temporary waiver of intellectual property is raised, we see lack of cooperation and even serious resistance. To be honest, I can't understand this because this pandemic is unprecedented. The virus has taken the whole world hostage. This thing happens probably once in 100 years. And in the TRIPS agreement, there is a provision for a waiver of intellectual property. But there are people who even don't want to discuss this issue. If this provision cannot be applied now, then when? If we cannot apply provisions for a difficult time like now during unprecedented conditions, then when? I think this is serious. I'm glad the UN Security Council has voted in favor of vaccine equity. And at the same time, if we're going to take practical solutions, then waiver of intellectual property should be taken seriously. And the UN Security Council can do it if there is political will. Voting for vaccine equity is important, and we appreciate that, but the concrete steps should be taken and waive intellectual property to increase production, increase coverage of vaccine or immunization, and get rid of this virus as soon as possible. If we're going to suggest in concrete terms, I think this is one. Of course, we should not just focus on this. We should not just focus on this. There are also other practical steps that can be taken, and where the UN Security Council has a big influence and bring vaccine equity as soon as possible to defeat this pandemic. So the choice is in our hands. This is something that can be done. I repeat again, if it cannot be done now in unprecedented times, in times of crisis like this that happens in 100 years maybe, when is it going to be used? When? I hope we will make the right choices, and in addition to the voting, we take concrete action. Thank you so much. And I would like also to thank Fadila. She has been moderating our pressers for some time now. And her and her colleagues do it in rotation. So one of her colleagues will come to help Christian. But I would like to use this opportunity to thank Fadila in a big way. Thank you so much. Shukran jazilan, Fadila.
Thank you, Dr. Tedros. I would like to thank also our journalists who are following us very regularly. I remind you that we will be sending the DG opening remark plus the audio file as soon as we finish here. The transcript will be posted on the WHO website tomorrow. Thank you for the opportunity of moderating these press conferences for the last 5 months. I'm sure you are in very good hands with my friend and colleague Christian Lindmeier as of next week. Thank you all and have a nice weekend.